So, obviously we touched a lot about this stuff, and you mentioned a great deal about this idea of, sunscreen's been using it for a long time. They don't cause cancer. One of the bigger thing is endocrine disrupting, right? Especially associated with oxybenzone. Can you comment a little bit on that?
Yeah. So in a similar fashion to the coral reef issue, that really came about from more basic science work and preclinical work, meaning with animals.
Yeah.
So there were kind of two studies. One was looking at the influence of oxybenzone on certain cancer cell lines, and it did show that it accelerated their growth. The second, which I think has less clinical translation, that they fed oxybenzone to rats in what's called a uterotropic assay, where they fed it and then they actually measured the weight of the uterus before and after, and showed that there was some thickening there, suggesting that there was influence on hormone disruption is an interesting word. There was some hormonal influence, and so you could say influence disruption. Disruption certainly is catchier and scarier. And I want to give you definitely a shout out for a nice editorial that you wrote where you mathematically calculated how much someone would have to apply sunscreen in over what time period to ever get the systemic levels that would possibly disrupt one's hormones. And it was astronomical. It was like, I think it was over 100 years. I don't remember the exact number, but I remember reading that and I was like slow clapping. Thank you, Steve, for that. Because it was really such a nice paper that demonstrated that, okay, in theory, that sounds nice, but really, what would someone have to do to ever emulate this in the
Yeah,
real
yeah,
world?
yeah. I mean, I think that's the problem. And you also, like, in the mathematical model we did, it was like 72 years if you just putting out, like, you do it every day, like regardless if it's like whether it's winter in Boston or something like that. But if you're just gonna do it in a certain way, let's say every day, just kind of put on the face and the hands every day, and in the summertime gonna put on everywhere, it's like almost 270 years. So again, it's, and then also does not take into account of your body is able to excrete the material out, right? So that's another thing.